fake Ozempic semaglutide pen does not always look obviously fake. Some warning signs are visual, but the bigger danger is the chain: prescription, pharmacy, package, label, liquid, and needle. The first red flag is not always the pen itself. It may be the story around it. One wrong pen can mean overdose, underdose, infection, or the wrong substance. Counterfeit means a fake product pretending to be the real product. With injected medicine, the risk is not only wasted money. The product may contain the wrong ingredient, the wrong amount, no active medicine, or contamination. The needle may also be unsafe before the medicine even enters your body. This problem is real because counterfeit Ozempic has been reported in the United States drug supply chain. Some fakes moved outside the normal legal supply chain, then reached places that looked legitimate. That is why the safest check starts before the pen touches your skin. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Start with the source. Ozempic should come through a valid prescription and a state-licensed pharmacy. A social media seller is not a shortcut. Neither is a cash-only text message, marketplace listing, or friend with extra pens. Legitimate mail-order pharmacy is different from random online buying. A licensed mail-order pharmacy should still require a prescription, provide pharmacist access, and maintain a clear dispensing record. The key question is not whether it arrived by mail. The key question is who dispensed it. Also, be careful with polished websites. Professional photos, customer reviews, and fast shipping do not prove the medicine is authentic. Check licensing through official state pharmacy lookup pages. Ask your clinician's office before trusting a new source for an injectable prescription. Price is a warning sign, but not a diagnosis. A dramatic discount does not prove a fake. It does change the risk calculation. Real pharmacy care leaves records, storage standards, pharmacist access, and a trail that can be checked. There is also a wording trap. Semaglutide on a label does not automatically mean FDA-approved Ozempic. Compounded semaglutide means a pharmacy-made version, not the branded pen. Some online products may be unapproved, falsely labeled, or made by a pharmacy that does not exist. Unapproved online products create a second trap. Some are marketed as research products. That means sellers claim they are for laboratory use, yet they still include dosing instructions for people. That does not make them safer. Unknown quality matters most when the product is injected into the body. Even after source and website checks, the physical product can still look convincing. It may arrive in a box with a pen, a label, and instructions. That is where many people make the wrong assumption. If the label looks familiar, the pen must be fine. Start the physical check with the box. Spelling errors, rough printing, weak glue, damaged seals, or mismatched details should stop the process. The carton and pen should tell the same story about strength, lot, expiration date, and product information. The United States Food and Drug Administration, or FDA, warned about counterfeit Ozempic labeled with lot PAR1229. The hard part is this: a correct-looking label can still sit on a fake pen. The visual clue involved the EXP text, meaning expiration date, and the LOT text, meaning batch number. On the counterfeit version, those words appeared beside the numbers, not above them. That detail helps, but it does not solve the problem. A real lot number can be copied. One warning pattern cannot prove that every other pen is safe. So widen the check after the label. A safe review uses layers: source, prescription, pharmacy, carton, pen label, liquid, needle package, storage history, and symptoms. The goal is not to memorize every fake. The goal is to catch a broken chain. The pen itself is the next layer. The label should be clean, firmly attached, and professionally printed. A loose label, crooked label, blurry label, or easy-to-peel label is a stop sign. Do not inject from a pen that looks tampered with. Then look at the liquid. It should not look cloudy, colored, or filled with particles. You are not expected to act like a laboratory. You are expected to pause when the medicine looks different from what your pharmacy explained. Dose markings can create false confidence. A fake pen can be labeled 1 milligram and still be unsafe. The liquid may be too strong, too weak, contaminated, or not semaglutide at all. The printed dose can be misleading. Storage can break the chain too. A legitimate prescription can still become risky after poor handling. Heat, freezing, unknown shipping time, or damaged packaging can change the safety picture. A pen mailed loosely from a stranger is not controlled pharmacy care. The needle is the final contact point. Sterility means the needle is free from infection-causing germs. With counterfeit supplies, sterility may be impossible to confirm. Redness, warmth, swelling, pus, fever, or worsening pain after injection should not be ignored. Keep the injection system intact. Do not transfer medicine from a suspicious pen into another syringe. Do not combine a questionable pen with spare needles from another box. The device, needle, and liquid are one connected safety system. Do not try to rescue a questionable product. A smaller test dose is not a safety test. Sharing a questionable pen with another person removes prescription review, dose matching, allergy checks, and pharmacy tracking. Unknown medicine stays unknown, even in a smaller dose. Stop before injection when the seller, price, label, liquid, package, storage, or needle looks wrong. A suspicious product should stop at the skin, not after the injection. Missing one questionable injection is safer than taking an unknown one. For unclear records, call the pharmacy using a number you find independently. Do not rely only on the number printed on a suspicious package. Ask whether the medication came from that pharmacy. Ask whether the lot matches their records. Ask whether it was dispensed to you. If the pharmacy says no record exists, do not assume the file is merely missing. A missing record means the chain cannot be verified from the place that should know. That is enough reason to pause and contact your prescriber before taking any more doses. If the pharmacy cannot confirm the record, set the product aside and do not use another pen from the same shipment. Save the messages and shipping label. Ask your clinician or pharmacist how to dispose of the product safely. If you already injected a questionable pen, symptoms need context. Nausea, vomiting, diarrhea, belly pain, and constipation can happen with real Ozempic. Fainting, confusion, trouble breathing, severe swelling, or intense belly pain needs urgent care. Write down the dose, time, source, lot number, symptoms, and photos. Keep the product, carton, needle package, receipt, shipping label, and messages. Do not wash, refill, or alter the package. Those items help the right people trace the problem. Suspected counterfeits can be reported through the FDA MedWatch program. MedWatch is a reporting system for side effects and product quality problems. Reporting may protect another patient who received the same shipment. It also helps regulators see patterns that one clinic or pharmacy may miss. Do not trust the label alone. Verify the source, inspect the product, and stop before injection when anything feels wrong. After suspicion, save evidence and get medical help for serious symptoms. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.